everyone, this is Nurse Anna from nursestudy.net, and here are 75 questions on urinary disorders with answers and rationales. The last one I did was, I believe, 25 questions, and people tend to want 75 questions, so that's what I did here. If there is a topic you want me to do test questions on, please leave it in the comments below. Thank you.
Would you like free audiobooks? Click the link in the description. Question 1. A 45-year-old female presents to the emergency department with severe flank pain, nausea, and hematuria. A CT scan reveals a 6 mm kidney stone in the ureter. Which intervention should the nurse anticipate to manage the patient's pain? A. Administering morphine sulfate IV. B. Initiating intravenous fluids at 100 milliliters per hour. C. Preparing the patient for lithotripsy. D. Encouraging the patient to drink plenty of fluids. Answer: A. Administering morphine sulfate IV. Rationale: severe pain from kidney stones often requires potent analgesics like morphine. While other options are part of the management plan, immediate pain relief is critical. Question 2. A patient with chronic kidney disease, CKD, is experiencing oliguria, generalized edema, and hypertension. What is the most critical lab value for the nurse to monitor in this patient? A. Serum creatinine. B. Blood urea nitrogen, BUN. C. Potassium level. D. Glomerular filtration rate, GFR. Answer: C. Potassium level. Rationale: hyperkalemia is a life-threatening complication in CKD patients. Elevated potassium levels can cause cardiac dysrhythmias, making it critical to monitor. Question 3. A 60-year-old male with a history of benign prostatic hyperplasia, BPH, reports difficulty urinating and a weak urine stream. Which medication should the nurse anticipate will be prescribed? A. Tamsulosin, Flomax. B. Ciprofloxacin, Cipro. C. Furosemide, Lasix. D. Metoprolol, Lopressor. Answer: A. Tamsulosin, Flomax. Rationale: tamsulosin is an alpha blocker that relaxes the muscles in the prostate and bladder neck, improving urine flow in patients with BPH. Question 4. A patient with pyelonephritis is prescribed ciprofloxacin 500 mg twice daily. What important teaching should the nurse provide regarding this medication? A. Take this medication with milk or antacids. B. Avoid excessive sunlight and wear sunscreen when outdoors. C. Decrease fluid intake to reduce kidney workload. D. Expect your urine to turn a bright orange color. Answer: B. Avoid excessive sunlight and wear sunscreen when outdoors. Rationale: ciprofloxacin can cause photosensitivity, so patients should avoid excessive sunlight and use sunscreen to prevent sunburn. Question 5. A patient with nephrotic syndrome is admitted with severe edema and proteinuria. Which dietary modification should the nurse expect to be included in the care plan? A. High protein diet. B. Low sodium diet. C. High potassium diet. D. Low carbohydrate diet. Answer: B. Low sodium diet. Rationale: a low sodium diet helps manage edema associated with nephrotic syndrome by reducing fluid retention. Question 6. A 70-year-old male with a history of diabetes is admitted with acute urinary retention. What is the priority nursing action? A. Insert an indwelling urinary catheter. B. Administer a diuretic medication. C. Encourage the patient to drink water. D. Schedule an ultrasound of the bladder. Answer: A. Insert an indwelling urinary catheter. Rationale: acute urinary retention requires immediate relief of bladder distension, typically achieved through catheterization. Question 7. A patient undergoing hemodialysis reports muscle cramps and tingling in the hands and feet. Which electrolyte imbalance is most likely causing these symptoms? A. Hypocalcemia. B. Hypernatremia. C. Hypokalemia. D. Hypermagnesemia. Answer: A. Hypocalcemia. Rationale: hypocalcemia can occur in patients on hemodialysis and is characterized by muscle cramps and tingling. Question 8. A patient with a urinary tract infection, UTI, is prescribed trimethoprim sulfamethoxazole, Bactrim. Which instruction is essential for the nurse to give the patient? A. Discontinue the medication once symptoms subside. B. Take the medication on an empty stomach. C. Increase fluid intake to 2 to 3 liters per day. D. Expect a metallic taste in your mouth. Answer: C. Increase fluid intake to 2 to 3 liters per day. Rationale: increasing fluid intake helps flush bacteria from the urinary tract and aids in the effectiveness of the antibiotic. Question 9. A patient with polycystic kidney disease, PKD, is experiencing hypertension and headaches. Which complication is the nurse most concerned about? A. Urinary tract infection. B. Intracranial aneurysm. C. Nephrolithiasis. D. Chronic pyelonephritis. Answer: B. Intracranial aneurysm. Rationale: PKD can be associated with the development of intracranial aneurysms, which can lead to severe complications if ruptured. Question 10. A nurse is caring for a patient with bladder cancer who is scheduled for a cystectomy with ileal conduit creation. What preoperative teaching is most important? A. You will need to perform intermittent self-catheterization. B. You will have a permanent external pouch to collect urine. C. You will be on a clear liquid diet for a week after surgery. D. You will experience no change in urinary function. Answer: B. You will have a permanent external pouch to collect urine. Rationale: post-cystectomy with an ileal conduit, the patient will need to use a urostomy bag to collect urine, as the bladder will be removed. Question 11. A 55-year-old female presents with dysuria, frequency, and urgency. Urinalysis shows positive nitrites and leukocyte esterase. What is the most likely diagnosis? A. Interstitial cystitis. B. Urinary tract infection, UTI. C. Renal calculi. D. Bladder cancer. Answer: B. Urinary tract infection, UTI. Rationale: the presence of nitrites and leukocyte esterase in the urine is indicative of a bacterial urinary tract infection. Question 12. A patient with end-stage renal disease, ESRD, is experiencing pruritus and muscle twitching. Which laboratory result should the nurse monitor to understand the cause of these symptoms? A. Serum calcium. B. Serum phosphorus. C. Blood urea nitrogen, BUN. D. Serum magnesium. Answer: B. Serum phosphorus. Rationale: elevated serum phosphorus levels in ESRD can cause pruritus and muscle twitching due to calcium phosphate product imbalances. Question 13. A patient with acute glomerulonephritis presents with hematuria, proteinuria, and hypertension. Which dietary restriction is most appropriate for this patient? A. Low carbohydrate. B. Low protein. C. Low sodium. D. Low fat. Answer: C. Low sodium. Rationale: a low-sodium diet helps manage hypertension and fluid retention in patients with acute glomerulonephritis. Question 14. A 68-year-old male with a history of hypertension and diabetes is admitted with nephrotic syndrome. Which of the following is a priority nursing diagnosis? A. Risk for infection. B. Impaired gas exchange. C. Fluid volume excess. D. Activity intolerance. Answer: C. Fluid volume excess. Rationale: nephrotic syndrome often leads to significant fluid retention, making fluid volume excess a priority concern. Question 15. A patient with urinary incontinence is prescribed oxybutynin. Which side effect should the nurse monitor for? A. Diarrhea. B. Dry mouth. C. Increased urination. D. Weight gain. Answer: B. Dry mouth. Rationale: oxybutynin is an anticholinergic medication that can cause dry mouth as a common side effect. Question 16. A 35-year-old female with recurrent UTIs is advised to take prophylactic antibiotics. What is the most important teaching point for the nurse to include? A. Take the antibiotics only when you have symptoms. B. Continue the antibiotics even if symptoms subside. C. Stop the antibiotics if you experience any side effects. D. Increase fluid intake while on the antibiotics. Answer: D. Increase fluid intake while on the antibiotics. Rationale: increasing fluid intake helps flush the urinary tract and supports the effectiveness of the antibiotics. Question 17. A patient with suspected bladder cancer is undergoing a cystoscopy. What post-procedure complication should the nurse monitor for? A. Hypotension. B. Hematuria. C. Anuria. D. Fever. Answer: D. Fever. Rationale: fever after cystoscopy can indicate an infection, which is a potential complication of the procedure. Question 18. A patient with a history of kidney transplantation is admitted with signs of rejection. Which symptom is most indicative of this complication? A. Hypertension. B. Polyuria. C. Graft tenderness. D. Hematuria. Answer: C. Graft tenderness. Rationale: graft tenderness is a classic sign of kidney transplant rejection, indicating an immune response against the transplanted organ. Question 19. A patient is diagnosed with acute pyelonephritis. Which finding would indicate that the infection has reached the bloodstream? A. Persistent flank pain. B. Elevated white blood cell count. C. Positive blood cultures. D. Hematuria. Answer: C. Positive blood cultures. Rationale: positive blood cultures indicate that the infection has become systemic, suggesting sepsis secondary to pyelonephritis. Question 20. A nurse is providing discharge teaching to a patient with renal calculi. Which instruction is most important to prevent recurrence? A. Limit your fluid intake to prevent strain on the kidneys. B. Increase dietary calcium intake to prevent stone formation. C. Avoid high oxalate foods such as spinach and nuts. D. Include more protein in your diet. Answer: C. Avoid high oxalate foods such as spinach and nuts. Rationale: high oxalate foods can contribute to the formation of calcium oxalate stones, which are the most common type of kidney stones. Question 21. A patient with bladder outlet obstruction is at risk for hydronephrosis. What is the primary nursing intervention to prevent this complication? A. Encourage frequent bladder emptying. B. Monitor serum creatinine levels. C. Administer diuretics as prescribed. D. Restrict fluid intake. Answer: A. Encourage frequent bladder emptying. Rationale: frequent bladder emptying helps prevent urine from backing up into the kidneys, thereby reducing the risk of hydronephrosis. Question 22. A patient with nephrotic syndrome is experiencing severe hypoalbuminemia. What clinical manifestation is most likely associated with this condition? A. Hypernatremia. B. Edema. C. Hypertension. D. Polyuria. Answer: B. Edema. Rationale: severe hypoalbuminemia reduces oncotic pressure, leading to fluid leakage into interstitial spaces and resulting in edema. Question 23. A nurse is caring for a patient with acute tubular necrosis, ATN. Which diagnostic test is most useful in evaluating the severity of this condition? A. Urinalysis. B. Renal ultrasound. C. Serum creatinine. D. Renal biopsy. Answer: C. Serum creatinine. Rationale: serum creatinine levels are a key indicator of kidney function and help evaluate the severity of acute tubular necrosis. Question 24. A patient with interstitial cystitis, IC, is prescribed pentasam polysulfate sodium. What is the primary purpose of this medication? A. To treat infection. B. To reduce inflammation. C. To repair the bladder lining. D. To increase urine output. Answer: C. To repair the bladder lining. Rationale: pentasam polysulfate sodium helps to restore the protective glycosaminoglycan layer of the bladder, reducing symptoms of interstitial cystitis. Question 25. A patient with severe hypertension is diagnosed with renal artery stenosis. Which treatment option should the nurse anticipate? A. Beta blocker therapy. B. Angioplasty with stent placement. C. Dialysis initiation. D. Dietary sodium restriction. Answer: B. Angioplasty with stent placement. Rationale: angioplasty with stent placement can help improve blood flow to the kidneys and reduce hypertension caused by renal artery stenosis. Question 26. A patient with a history of UTIs presents with fever, chills, and costovertebral angle tenderness. What is the most likely diagnosis? A. Cystitis. B. Urethritis. C. Pyelonephritis. D. Prostatitis. Answer: C. Pyelonephritis. Rationale: fever, chills, and costovertebral angle tenderness are classic signs of pyelonephritis, an upper urinary tract infection. Question 27. A nurse is reviewing the medication list of a patient with chronic kidney disease, CKD. Which medication class should be used with caution due to the risk of hyperkalemia? A. Calcium channel blockers. B. Beta blockers. C. Angiotensin converting enzyme, ACE, inhibitors. D. Statins. Answer: C. Angiotensin converting enzyme, ACE, inhibitors. Rationale: ACE inhibitors can cause hyperkalemia, especially in patients with CKD, and should be used with caution. Question 28. A patient with bladder cancer is receiving intravesical chemotherapy. What is the purpose of this treatment? A. To shrink the tumor before surgery. B. To reduce systemic side effects. C. To treat metastatic disease. D. To prevent recurrence of cancer. Answer: D. To prevent recurrence of cancer. Rationale: intravesical chemotherapy is administered directly into the bladder to prevent recurrence of superficial bladder cancer. Question 29. A patient with a urinary catheter in place is at risk for developing a catheter-associated urinary tract infection, CAUTI. What is the best nursing intervention to prevent this complication? A. Administer prophylactic antibiotics. B. Change the catheter every 72 hours. C. Maintain a closed drainage system. D. Increase fluid intake to 3 liters per day. Answer: C. Maintain a closed drainage system. Rationale: maintaining a closed drainage system helps prevent the introduction of bacteria into the urinary tract, reducing the risk of CAUTI. Question 30. A patient with diabetic nephropathy is experiencing proteinuria. Which medication should the nurse anticipate being prescribed to protect kidney function? A. Metformin. B. Losartan. C. Furosemide. D. Atorvastatin. Answer: B. Losartan. Rationale: losartan, an angiotensin II receptor blocker, helps reduce proteinuria and protect kidney function in patients with diabetic nephropathy. Question 31. A patient presents with sudden onset of severe right flank pain, hematuria, and nausea. A diagnosis of nephrolithiasis is made. Which diagnostic test is most appropriate to confirm the location and size of the kidney stone? A. Abdominal X-ray. B. Urinalysis. C. Intravenous pyelogram (IVP). D. Non-contrast CT scan. Answer: D. Non-contrast CT scan. Rationale: a non-contrast CT scan is the most sensitive and specific test for identifying the size and location of kidney stones. Question 32. A patient with chronic pyelonephritis is being discharged. Which instruction is most important to include in the discharge teaching? A. Take your antibiotics until you feel better. B. Avoid caffeinated beverages. C. Complete the entire course of prescribed antibiotics. D. Restrict your fluid intake to prevent swelling. Answer: C. Complete the entire course of prescribed antibiotics. Rationale: completing the entire course of antibiotics is crucial to ensure the infection is fully treated and to prevent recurrence. Question 33. A patient with severe hypertension secondary to renal artery stenosis is scheduled for a renal angioplasty. What is the primary goal of this procedure? A. To remove a kidney stone. B. To bypass the renal artery. C. To dilate the renal artery and improve blood flow. D. To remove a renal cyst. Answer: C. To dilate the renal artery and improve blood flow. Rationale: renal angioplasty aims to dilate the narrowed renal artery to improve blood flow and reduce hypertension. Question 34. A nurse is caring for a patient with acute renal failure who is oliguric. Which electrolyte imbalance is the nurse most concerned about? A. Hyponatremia. B. Hyperkalemia. C. Hypocalcemia. D. Hypermagnesemia. Answer: B. Hyperkalemia. Rationale: hyperkalemia is a common and potentially life-threatening complication of acute renal failure, especially during the oliguric phase. Question 35. A patient with autosomal dominant polycystic kidney disease, ADPKD, is experiencing increasing flank pain and hematuria. What is the most likely cause of these symptoms? A. Kidney stone formation. B. Rupture of a cyst. C. Urinary tract infection. D. Renal artery stenosis. Answer: B. Rupture of a cyst. Rationale: in ADPKD, flank pain and hematuria are often due to the rupture of a kidney cyst, which can cause bleeding and pain. Question 36. A patient with a history of urinary retention is scheduled for urodynamic testing. What is the purpose of this diagnostic test? A. To evaluate the bladder's ability to store and release urine. B. To detect the presence of kidney stones. C. To measure the volume of urine left in the bladder after voiding. D. To identify urinary tract infections. Answer: A. To evaluate the bladder's ability to store and release urine. Rationale: urodynamic testing assesses how well the bladder stores and releases urine, helping diagnose conditions like urinary retention and incontinence. Question 37. A patient with nephrotic syndrome is at risk for developing deep vein thrombosis, DVT. Which symptom should the nurse monitor for as an indication of this complication? A. Dyspnea and chest pain. B. Unilateral leg swelling and pain. C. Abdominal pain and distension. D. Hematuria and proteinuria. Answer: B. Unilateral leg swelling and pain. Rationale: unilateral leg swelling and pain are classic signs of DVT, a potential complication in patients with nephrotic syndrome due to hypercoagulability. Question 38. A patient with a new diagnosis of bladder cancer asks about the purpose of a transurethral resection of bladder tumor, TURBT. What is the nurse's best response? A. TURBT involves removing a section of the bladder to prevent cancer spread. B. TURBT is used to diagnose and remove superficial bladder tumors. C. TURBT involves chemotherapy treatment directly into the bladder. D. TURBT is a procedure to repair bladder function. Answer: B. TURBT is used to diagnose and remove superficial bladder tumors. Rationale: TURBT is a surgical procedure to diagnose and remove superficial bladder tumors, often used as a first-line treatment for bladder cancer. Question 39. A patient with chronic kidney disease, CKD, is experiencing metabolic acidosis. Which finding is most consistent with this condition? A. Increased serum bicarbonate. B. Decreased blood pH. C. Elevated blood glucose. D. Decreased serum potassium. Answer: B. Decreased blood pH. Rationale: metabolic acidosis in CKD is characterized by a decreased blood pH due to the kidney's inability to excrete acid and reabsorb bicarbonate. Question 40. A patient is admitted with acute urinary retention. Which immediate intervention is most appropriate? A. Encouraging the patient to drink warm fluids. B. Applying a warm compress to the lower abdomen. C. Performing intermittent catheterization. D. Administering a diuretic. Answer: C. Performing intermittent catheterization. Rationale: immediate relief of urinary retention is best achieved through catheterization to decompress the bladder and prevent complications. Question 41. A nurse is caring for a patient with acute glomerulonephritis. Which laboratory finding should the nurse monitor to assess the severity of the condition? A. Elevated hemoglobin. B. Decreased serum albumin. C. Increased antistreptolysin O, ASO, titer. D. Increased serum creatinine. Answer: D. Increased serum creatinine. Rationale: increased serum creatinine indicates impaired kidney function, which is a key measure of the severity of acute glomerulonephritis. Question 42. A patient with a urinary tract infection, UTI, is prescribed phenazopyridine. What is the most important teaching point regarding this medication? A. This medication will cure your infection. B. Take this medication on an empty stomach. C. Expect your urine to turn a red-orange color. D. Avoid driving while taking this medication. Answer. C. Expect your urine to turn a red-orange color. Rationale: phenazopyridine is a urinary analgesic that can cause red-orange discoloration of the urine, which is a normal and expected side effect. Question 43. A patient with chronic kidney disease, CKD, is experiencing severe anemia. Which treatment is most likely to be prescribed to manage this condition? A. Iron supplements. B. Erythropoiesis-stimulating agents, ESAs. C. Blood transfusions. D. Vitamin B12 injections. Answer. B. Erythropoiesis-stimulating agents, ESAs. Rationale: ESAs are used to stimulate red blood cell production in patients with CKD-related anemia, reducing the need for blood transfusions. Question 44. A patient with severe dehydration presents with oliguria and increased serum creatinine. Which type of acute kidney injury, AKI, is most likely? A. Prerenal AKI. B. Interrenal AKI. C. Postrenal AKI. D. Chronic AKI. Answer. A. Prerenal AKI. Rationale: severe dehydration can lead to prerenal AKI due to decreased blood flow to the kidneys, causing oliguria and increased serum creatinine. Question 45. A nurse is providing education to a patient with a new ileal conduit for urinary diversion. What is the most important self-care instruction to include? A. Clean the stoma with alcohol daily. B. Change the urostomy bag once a week. C. Drink plenty of fluids to prevent urinary tract infections. D. Avoid any physical activity for at least 6 months. Answer. C. Drink plenty of fluids to prevent urinary tract infections. Rationale: adequate fluid intake helps prevent urinary tract infections in patients with an ileal conduit by promoting urine flow and reducing bacterial colonization. Question 46. A patient with nephrolithiasis is experiencing severe colicky pain. Which analgesic medication is most appropriate for immediate pain relief? A. Acetaminophen. B. Ibuprofen. C. Morphine sulfate. D. Aspirin. Answer. C. Morphine sulfate. Rationale: morphine sulfate is a potent opioid analgesic that provides immediate and effective pain relief for severe colicky pain associated with kidney stones. Question 47. A patient with pyelonephritis is prescribed ciprofloxacin. Which potential side effect should the nurse instruct the patient to report immediately? A. Nausea. B. Diarrhea. C. Tendon pain. D. Dizziness. Answer. C. Tendon pain. Rationale: ciprofloxacin can cause tendinitis and tendon rupture, a serious side effect that requires immediate medical attention if tendon pain occurs. Question 48. A patient with chronic kidney disease, CKD, is on a low-protein diet. What is the primary reason for this dietary restriction? A. To reduce fluid retention. B. To lower blood pressure. C. To decrease the workload on the kidneys. D. To prevent hyperkalemia. Answer. C. To decrease the workload on the kidneys. Rationale: a low-protein diet reduces the production of urea and other nitrogenous wastes, decreasing the workload on the kidneys in patients with CKD. Question 49. A patient with recurrent urinary tract infections, UTIs, is advised to take cranberry supplements. What is the proposed benefit of this intervention? A. Cranberry increases urine acidity. B. Cranberry kills bacteria in the urinary tract. C. Cranberry inhibits bacterial adherence to the bladder wall. D. Cranberry reduces urinary frequency. Answer: C. Cranberry inhibits bacterial adherence to the bladder wall. Rationale: cranberry supplements are thought to prevent bacteria from adhering to the bladder wall, thereby reducing the risk of recurrent UTIs. Question 50. A patient with nephrotic syndrome is being monitored for signs of thromboembolism. Which clinical manifestation would be most concerning? A. Hematuria. B. Shortness of breath. C. Hypertension. D. Abdominal pain. Answer: B. Shortness of breath. Rationale: shortness of breath can indicate a pulmonary embolism, a potential complication of nephrotic syndrome due to hypercoagulability. Question 51. A patient is diagnosed with renal calculi composed of uric acid. Which dietary modification should the nurse recommend? A. Increase intake of dairy products. B. Avoid high purine foods such as red meat and shellfish. C. Increase intake of citrus fruits. D. Reduce sodium intake. Answer: B. Avoid high purine foods such as red meat and shellfish. Rationale: high purine foods can increase uric acid levels, contributing to the formation of uric acid stones. Question 52. A nurse is caring for a patient with acute kidney injury, AKI, who is experiencing hyperkalemia. Which medication is likely to be administered to lower the serum potassium level? A. Calcium gluconate. B. Sodium bicarbonate. C. Insulin and glucose. D. Furosemide. Answer: C. Insulin and glucose. Rationale: insulin and glucose help to drive potassium into cells, thereby lowering the serum potassium level in patients with hyperkalemia. Question 53. A patient with bladder cancer is receiving Bacillus calmette-guerin (BCG) therapy. What is the primary goal of this treatment? A. To reduce tumor size. B. To enhance the immune response against cancer cells. C. To prevent metastasis. D. To alleviate symptoms. Answer: B. To enhance the immune response against cancer cells. Rationale: BCG therapy stimulates the immune system to attack bladder cancer cells, reducing the risk of recurrence. Question 54. A patient with a history of renal calculi is advised to follow a low oxalate diet. Which food should the patient avoid? A. Milk. B. Spinach. C. Chicken. D. Apples. Answer: B. Spinach. Rationale: spinach is high in oxalates, which can contribute to the formation of calcium oxalate kidney stones. Question 55. A patient with severe acute kidney injury, AKI, is receiving continuous renal replacement therapy, CRRT. What is the primary advantage of CRRT over intermittent hemodialysis? A. CRRT is less expensive. B. CRRT provides continuous fluid and waste removal. C. CRRT requires fewer dietary restrictions. D. CRRT is faster. Answer: B. CRRT provides continuous fluid and waste removal. Rationale: CRRT is beneficial for hemodynamically unstable patients because it provides continuous, gentle fluid and waste removal. Question 56. A nurse is caring for a patient with a suspected urinary tract obstruction. Which diagnostic test is most appropriate to confirm this condition? A. Kidney ureter bladder, KUB, X-ray. B. Renal ultrasound. C. Intravenous pyelogram, IVP. D. Urinalysis. Answer B. Renal ultrasound. Rationale: a renal ultrasound is a non-invasive test that can visualize obstructions in the urinary tract. Question 57. A patient with acute glomerulonephritis presents with oliguria and peripheral edema. Which dietary restriction is most appropriate? A. High protein. B. Low potassium. C. Low sodium. D. High calcium. Answer C. Low sodium. Rationale: a low sodium diet helps manage fluid retention and hypertension, which are common in acute glomerulonephritis. Question 58. A patient with interstitial cystitis reports increased bladder pain and urgency. Which non-pharmacological intervention can the nurse suggest to help alleviate symptoms? A. Increasing caffeine intake. B. Using a heating pad on the lower abdomen. C. Drinking carbonated beverages. D. Performing vigorous exercise. Answer B. Using a heating pad on the lower abdomen. Rationale: a heating pad can provide soothing relief for bladder pain and discomfort associated with interstitial cystitis. Question 59. A patient with polycystic kidney disease, PKD, is being monitored for the development of hypertension. Which pathophysiological mechanism is most responsible for this complication? A. Increased renin production. B. Decreased aldosterone secretion. C. Elevated blood glucose levels. D. Reduced erythropoietin production. Answer A. Increased renin production. Rationale: polycystic kidneys produce more renin, leading to hypertension due to the renin-angiotensin-aldosterone system activation. Question 60. A nurse is teaching a patient with nephrotic syndrome about the importance of a low-fat diet. What is the rationale behind this dietary modification? A. To reduce the risk of hyperlipidemia. B. To prevent proteinuria. C. To decrease blood pressure. D. To increase urine output. Answer A. To reduce the risk of hyperlipidemia. Rationale: nephrotic syndrome often leads to hyperlipidemia. A low-fat diet helps manage cholesterol levels and reduce cardiovascular risk. Question 61. A patient with chronic kidney disease, CKD, is experiencing hyperphosphatemia. Which dietary modification should the nurse recommend? A. Increase dairy intake. B. Avoid high phosphorus foods such as nuts and beans. C. Increase protein intake. D. Avoid citrus fruits. Answer B. Avoid high phosphorus foods such as nuts and beans. Rationale: patients with CKD should avoid high phosphorus foods to help manage hyperphosphatemia and prevent bone and cardiovascular complications. Question 62. A patient with a history of kidney transplantation is experiencing fever, graft tenderness, and decreased urine output. Which complication is most likely occurring? A. Acute rejection. B. Urinary tract infection. C. Chronic allograft nephropathy. D. Medication toxicity. Answer A. Acute rejection. Rationale: fever, graft tenderness, and decreased urine output are signs of acute rejection, which requires immediate medical intervention. Question 63. A patient with recurrent nephrolithiasis is advised to drink lemon juice daily. What is the rationale behind this recommendation? A. Lemon juice increases urine acidity. B. Lemon juice reduces calcium absorption. C. Lemon juice contains citrate, which inhibits stone formation. D. Lemon juice decreases urine volume. Answer. C. Lemon juice contains citrate, which inhibits stone formation. Rationale: citrate in lemon juice binds to calcium and helps prevent the formation of calcium oxalate stones. Question 64. A nurse is caring for a patient with acute kidney injury, AKI, who is receiving intravenous fluids. What is the primary goal of fluid administration in this patient? A. To increase urine output. B. To reduce blood pressure. C. To prevent hyperkalemia. D. To promote renal perfusion. Answer. D. To promote renal perfusion. Rationale: fluid administration in AKI aims to improve renal perfusion, supporting kidney function and aiding in recovery. Question 65. A patient with a urinary tract infection, UTI, is experiencing severe bladder spasms. Which medication is most appropriate for symptom relief? A. Phenazopyridine. B. Ciprofloxacin. C. Trimethoprim sulfamethoxazole. D. Nitrofurantoin. Answer. A. Phenazopyridine. Rationale: phenazopyridine is a urinary analgesic that provides relief from bladder spasms and discomfort associated with UTIs. Question 66. A patient with nephrotic syndrome is being monitored for complications. Which lab result is most concerning? A. Low serum albumin. B. Elevated serum cholesterol. C. Increased blood urea nitrogen, BUN. D. High serum creatinine. Answer. D. High serum creatinine. Rationale: high serum creatinine indicates impaired kidney function, which is a serious complication in patients with nephrotic syndrome. Question 67. A patient with chronic kidney disease, CKD, is prescribed a phosphate binder. What is the primary purpose of this medication? A. To increase calcium absorption. B. To reduce serum phosphate levels. C. To enhance kidney function. D. To prevent hyperkalemia. Answer. B. To reduce serum phosphate levels. Rationale: phosphate binders help reduce serum phosphate levels, preventing hyperphosphatemia and its associated complications in CKD patients. Question 68. A patient with bladder cancer is experiencing hematuria. Which diagnostic test is most appropriate to evaluate the extent of the cancer? A. Urinalysis. B. Bladder ultrasound. C. Cystoscopy. D. Intravenous pyelogram IVP. Answer. C. Cystoscopy. Rationale: cystoscopy allows direct visualization of the bladder and is the most appropriate test to evaluate the extent of bladder cancer. Question 69. A patient with acute kidney injury, AKI, is receiving continuous renal replacement therapy, CRRT. Which electrolyte imbalance is most likely to be corrected by this therapy? A. Hypercalcemia. B. Hyperkalemia. C. Hypophosphatemia. D. Hyponatremia. Answer. B. Hyperkalemia. Rationale: CRRT helps remove excess potassium from the blood, correcting hyperkalemia in patients with AKI. Question 70. A patient with interstitial cystitis, IC, is advised to avoid certain foods and beverages. Which items should the patient avoid to prevent symptom exacerbation? A. Bananas. B. Water. C. Coffee. D. Rice. Answer: C. Coffee. Rationale: coffee can irritate the bladder lining and exacerbate symptoms of interstitial cystitis, so it should be avoided. Question 71. A patient with nephrolithiasis is scheduled for extracorporeal shock wave lithotripsy, ESWL. What is the primary goal of this procedure? A. To surgically remove the kidney stone. B. To dissolve the kidney stone. C. To break the kidney stone into smaller pieces. D. To prevent future stone formation. Answer: C. To break the kidney stone into smaller pieces. Rationale: ESWL uses shock waves to break kidney stones into smaller pieces that can be passed more easily through the urinary tract. Question 72. A patient with chronic kidney disease, CKD, is experiencing severe pruritus. Which intervention is most appropriate to manage this symptom? A. Administering a diuretic. B. Applying moisturizing lotion. C. Encouraging a high-protein diet. D. Increasing fluid intake. Answer: B. Applying moisturizing lotion. Rationale: moisturizing lotion helps relieve pruritus by hydrating the skin, which is beneficial for patients with CKD. Question 73. A patient with acute pyelonephritis is prescribed intravenous antibiotics. Which clinical sign indicates that the treatment is effective? A. Decreased urine output. B. Increased blood pressure. C. Resolution of fever. D. Persistent flank pain. Answer: C. Resolution of fever. Rationale: the resolution of fever is a positive sign that the infection is responding to antibiotic treatment. Question 74. A nurse is caring for a patient with a history of recurrent urinary tract infections, UTIs. Which preventive measure should the nurse recommend? A. Taking cranberry supplements. B. Drinking caffeinated beverages. C. Wearing tight-fitting underwear. D. Using bubble baths regularly. Answer: A. Taking cranberry supplements. Rationale: cranberry supplements are believed to prevent bacteria from adhering to the bladder wall, helping reduce the risk of recurrent UTIs. Question 75. A patient with nephrotic syndrome is experiencing significant edema. Which diuretic is most likely to be prescribed to manage this symptom? A. Spironolactone. B. Hydrochlorothiazide. C. Furosemide. D. Acetazolamide. Answer: C. Furosemide. Rationale: furosemide is a potent loop diuretic that effectively reduces edema by increasing the excretion of sodium and water.